Hi, my name is Olga. Today I'm going to be presenting the subcutaneous injection. I'm in my appropriate school uniform. I will start by going over some of the supplies that I'm going to be using. I'm going to have my vial, my medication vial. I'm going to have my syringe, which in this case should be 25 to 27 gauge needle. It's 1 to 3 it's going to be 1 to 3 syringe. It's going to be 5 to 5/8 to 3/8. And in this case, we're going to be using this one, the one that's in my kit. I also will have my 2 alcohol wipes and my gauze that I can wipe out later. I have my gloves. So first of all, I'm gonna go over the 6 rights of medication. That is right patient, right drug, right dose, right route, right time, and right documentation. Next, I will confirm and go over in the EHR. I'm gonna confirm that it is the right medication. I'm gonna do that 3 times before giving any medication to a patient. Also, I am going to calculate my dosage. The patient is receiving heparin. That is, I wrote it down. It is 10 over here. It just says calculations, and there's nothing in the back. So the patient is going to be receiving 10 milliliter. It's going to be receiving 10 over 10,000 times 1,000 over 1 milliliter. Hold that up. All right, and that will equal to 1 milliliter of heparin for my patient. Okay, and then next I'm going to gather all my supplies. And I will knock and enter into the patient's room. I will place my place my equipment on a dry, clean surface. I will close my door for privacy. I want to make sure that there's no family members present for HIPAA violation. And I will go in and introduce myself. Hi, Ms. Smith. My name is Olga. Today I will be your nurse. Can you please verify your date of birth, your first name, and your last name? All right, perfect. And I'm going to check my wristband for 2 patient identifications. All right, Ms. Smith. I'm going to wash my hands. And I will start with the procedure. So, Ms. Smith, before we get started on anything, do you have any allergies? Any allergies for your medication? Any food allergy? Any seasonal allergies? No allergy. Okay, so today your doctor has prescribed you heparin. That is a anticoagulant. It's a medication that is used for surgeries or any vein or any bypass surgery. This is the use for it is to prevent clogging, blood clotting. Some of the side effects that can occur, which could be lots of bruising, maybe discoloration like redness, any burning or swollenness. But please let us know if you have any adverse reactions. That would include any severe pain, any blood in the stool, any urine, any blood in the urine, or if you are coughing out blood, please let us know. This is very severe, and we will want to take care of it as soon as possible. Do you have any questions for me? No questions? And then, all right. So then I will verify in the MR, the patient's medication, which is heparin, and we're giving our patient 1 milliliter. All right, next I'm going to apply my clean gloves. I'm going to hand hygiene. I'm going to apply my clean gloves. And I will start by wiping the top of my container. If there's a cap, I will remove it. Wipe it, let it air dry by itself. I will discard this. All right, next I'm going to open up my syringe. And I'm gonna hold it up as a pencil. And we will put in the air of 1 milliliter for a patient. So I'm gonna put in 1 milliliter of air. Okay, and I will show you guys 1 milliliter of air. Next, I will remove the cap. Put it in the vial and make sure that I don't touch the medication. I will push back the air into the vial. I will flip it upside down and I will put in 1 milliliter of medication. 1.1, 1.0 medication. I'll make sure that there's no bubbles, which in this case we are good to go. I will pull out. I will cap with one scoop method, and I will close it. And then I'm going to show you guys, it is 1 ml. Here we go. All right, so I'm just going to set this down. Next, I am going to assess the site. Usually for subcutaneous injections, the patient gets it in her upper arm, abdomen, or the thigh. In this case, our patient, due to rotation methods, is going to get her injection in the abdomen. So I will assess the site. I will grab and I will make sure that top to bottom, make sure that I measure it, that the needle is 1/2 inch in, which it is. And we will assess for any inflammation, any edema, any infection. We will tap for tenderness or masses. Any tenderness here? No? Okay. So this is the site that we're going to be injecting. Next, I'm going to take my alcohol wipe, and we are going to clean the area, and it's going to be 5 inches to, it's going to start by 5 centimeters, 2 inches out. There we go. We discard this and we let it dry. We do not touch it. Next, we are going to get ready to inject. We're going to grab our syringe. We're going to grab with the non-dominant hand to take off this. We're going to go at a 45 to 90 angle. I'm going to grab with my dominant hand, and we're going to quickly insert it as a dart, palms down. I'll grab it here with my dominant hand. I will push in the medication, and I will grab a gauze, and I will discard it in the sharps container, biohazard. I'll lightly do that and take it off. I will put Band-Aid as needed, and I will discard everything. I will not recap my needle, and I will discard everything. Thing back. I will take off my gloves. Discard hand hygiene, and I will go ahead and make sure that my patient is doing well. She has her call light, and I will document this in the computer. Thank you.